Okay, so for blood draw, you would check your medical order, and then you would gather your supplies, which is your biohazard bag, some tape, a tourniquet, a alcohol pad. I'm going to use a butterfly needle, the vacuum container, and then 2 tubes, and a cotton ball. And then you would identify your patient by their wristband and asking them for their name and date of birth. You would also explain to the patient why they're receiving the blood draw and the procedure to the blood draw. And then you would also identify yourself. And you would perform hand hygiene. And then you would prepare everything. Go ahead and put this on here. Okay, that out of the way. I'm sorry if you hear my cat. Go ahead and place the tourniquet. Okay, then you would use the alcohol prep pad and wipe the area that you're going to do the puncture for 30 seconds. Finish with that. And then I would go ahead and get a piece of tape to tape down the cotton ball afterwards. I'll put that right there. Okay, and then you would put on gloves. All right. Take the butterfly needle. Remove the cap. Make sure the bevel is up. Do not touch the site, but I'm going to hold down the vein so it doesn't roll. And then you would insert the butterfly needle into the vein. Look for blood return. And then at this point you can hold down the butterfly needle. Press this in. Fill up the tubes. Okay. And then once that's finished, you can pop the tourniquet off of the patient. You would grab your cotton ball and place it, and then you would remove the needle, hold pressure on the site to stop the bleeding, and then you would either activate your safety device or throw it in the sharps container. And then you would take your tape and you would apply the tape onto the cotton ball. Okay. And then you would make sure that your tubes are fully labeled. Make sure you have any paperwork that needs to go with it. And then you would seal it off and send it off to the lab. You would document, and you would make sure that your patient is left in a comfortable position, and you would perform hand hygiene before you leave. That is all.